Our next presenter is Mr. Silva Yagi. He's the HIV Program eHealth and Health Information Officer under World Vision. And his presentation this morning will be on HIV Commodities Management using eHealth Informatics. Please make him welcome. Thank you, Mr. Yagi.
Good morning. Thank you. Thank you for the introduction, Bechiba. Also, thank you to the One Nation Committee for putting together such a wonderful gathering. I was looking through the program and for the 3-day event, and I am amazed at the amount of work that you all have been doing in the pharmacy space. This work cannot go unnoticed as it contributes towards supporting and strengthening the broader national health system. I am humbled to stand here today to present work that the hardworking team in the National HIV and STI Program have been doing to support HIV commodities management through the use of technology. My name is Silva Yagi. I'm an health informatician supporting the rollout of eHealth initiatives which are being implemented at the health department within the HIV program. Effective HIV Commodities Management Through eHealth is the title of my presentation. When we hear eHealth, health informatics, national health information systems, logistics management information systems, or any information systems in health, we know that there is one or more interconnected databases running behind the scenes. So for the HIV program, we have an ecosystem of several databases and information systems running concurrently to make up the HIV data system. HIV commodities data is a part of that ecosystem that is managed through the eLIMS or M-Supply. The components of this ecosystem include HPDB, the first one, which is a facility-based electronic medical record system. The second one is the SafeDB, which is an aggregate database system. And we have the other one on the other side, which is VLSM. It's the patient-level viral load sample management system. And ENHIS. HIV being a lifelong disease presents a unique opportunity to track a HIV-positive person throughout their life. Most important data being commodities consumed by that individual. Details like the number of VL tests done and the result, the type of regimen they're on and the number of days dispensed, opportunistic infections they're treated with, their consumption of TB consumables, etc., are tracked at the facility level per patient. With the aggregate systems, which is also the paper-based system, these details are at most times left out when the data is summarized and submitted. This in turn affects our forecasting, projections, and estimations. Realizing this, the HIV Strategic Information Technical Working Group, comprising of members from the program and its development partners, got together and developed the current digital health system, or the HIV Data System. This system is modeled around the existing paper-based case-by-case patient medical record system. Through the use of HIV patient database, the national program can now have visibility over each unique HIV patient case at each facility. Although a much better improvement, some challenges still exist. Currently, to track and accurately forecast HIV commodities usage and consumption, the national HIV cascade data triangulation is required from multiple data sources. The ecosystem was reassessed and redesigned to now work around a centralized DHIS2 platform. The primary focus to utilize DHIS2 is a centralized platform for integrated data management and data visualization. We have legacy HPDB sites, new M-Supply or HPDB sites, non-HPDB and ENHIS sites, SEV form-only sites. They're all submitting their data to the DHIS2 platform, which then gets distributed to NDOH, PHS, and CSO. So that is the future of the data system for HIV. We are only 12 strong at the department and cannot do most of the work that we're doing without the ongoing support of Go PNG through NDOH, CPHL, NEXT, and also there is no IN team. And that's where we draw our strengths from. We couldn't have come this far without our partners. Closing off, the greatness of a country is not judged by its wealth, but rather by the way it takes care of its citizens, with no one left behind. Thank you.
Thank you, Mr. Silva Yagi, for that lovely presentation. We understand that HIV/AIDS is an issue in our country, and with eHealth we can move mountains for some of us who live where there's mountains and oceans and valleys and everywhere across Papua New Guinea. One of the important things he put there was the database management, and it would be nice if it was just a click away and we'd get all the information we wanted. Like, we're already tired of carrying clinic books. So thank you for that wonderful presentation and insight to the program HIV/AIDS and eHealth in what future plans also, despite the challenges of manpower and tracking management of the commodities.
In terms of the challenges, I think not only a lot of programs are confused because they have not getting or aligning their plan to the national health plan. And I can commend the HIV program because I've been involved with them from the start. And now they have a mechanism, reporting mechanism pathway clearly in terms of digital transformation. And we have just seen the presentation. For us, we have a long way to go.